So today we're doing a combined hairline advancement and brow lift. So in this case we're going to bring the brows up a bit just for some support to open up the upper eyelid area. We're also going to be reducing the forehead, a forehead reduction, also known as a hairline advancement. So in this case, this patient is going to have an incision right along the hairline. We're going to bring the whole hairline forward, okay, and bring the brows up, and in doing so, the skin that we have marked out here is going to go bye-bye, and we're going to basically have the hairline at this new marked out incision here, which is about 2 centimeters lower. So she'll have the brows up and the hairline down, and the net result will be that the forehead itself will be much shorter and a much more aesthetically pleasing appearance. Okay, so we're all finished with the hairline advancement or forehead reduction in conjunction with a trichophytic brow lift. So we've lifted her brows and brought them into a more youthful position in order to open up the upper eyelid area. We've also advanced the scalp or the hairline forward or downward in order to shorten the distance of the forehead or the height of the forehead. And these little clips will be out within 7 to 10 days, and that incision will heal very nicely. The hair will grow through that incision to hide it. In this case, we did a combination of 2 techniques in order to lift the brows and also to bring the hairline down, but we also do these 2 procedures independently, so we can lift just the brows or bring just the hairline down, and we do both of those independently all the time. But in this case, this patient had issues with both areas, and so we did a combination technique. The great thing about that is there's only 1 incision and 1 scar, and it's going to hide very nicely, and within just a few months there will be no signs of this surgery.